The eyes are on the Jersey Shore. Hello, I am Vin Avenue here in the Town Square Media Jersey Shore newsroom in downtown Toms River. And my guests today are a couple of people from Bright Harbor Healthcare, formerly and until recently known as Ocean Mental Healthcare. It's Jim Cooney, the CEO, and Kim Veith, the Director of Adult Clinical Services, here to talk about, of course, the name change, because everybody wants to know what's behind a good name change, but also, certainly more importantly, some of the services that they offer to everybody around Ocean County, around the shore and beyond here. So I say welcome to you both. Thank you for taking out the time here today.
Thank you.
Thank you very much, Vin.
Excellent, excellent. So I guess the exciting part of it was, I guess, the name change after almost 60 years of Ocean Mental Health providing so many different services to people around the area here. So what went into the name change? What went into, why now? What went into calling it, or the name change itself, the actual name?
I think we're actually overdue with changing the name, because Ocean Mental Health Services was so much more than just the mental health services. And we've been saying that now, but we have a very vibrant addiction treatment series of programs. We have specialty programs for depression, such as TMS. We have a special education school. We have a pharmacy service. We have laboratories. We just do a lot of different things. And so it was really time to broaden. We also have a primary care office. So it's time to broaden our name and kind of take credit for some of the things that we do. So I've been advocating for it for a couple of years. The board got on board and said, let's do that back in January, almost a year ago. We got involved, all the staff, in the process of coming up with a name. And actually, we came down to two names at the very end, and the staff voted on them and chose Bright Harbor Healthcare. So we're thrilled with the name. I think it's a wonderful name. It really kind of describes very positive things about what we do.
I think it also is cool because of where we are on the shore. I hear Bright Harbor. I mean, one of the things I think of harbor, we got the Barnegat Bay, a lot of different waterways here. You kind of think of maybe a water tower or a lighthouse or something like that. So how exciting was this name change for you, Kim?
It was really exciting. A couple of years back, we had really started to follow the trend of taking care of the whole person and whole person health. And so mental health talked a little bit about what we did, but not all of it. And so I was really excited about the name change as well, because I think it really brings us to a place where, people will think about us for more than just mental health treatment, although that's what we've been so good at for so long. And the name change was exciting because it was really it came down to a really big competition between two names, and which one was going to win out. So it was pretty exciting.
Competition could be fun, in that case. No, I think it should be this one. No. So, hey, I think everybody settled in on a good one, and something that everybody will start to recognize more in the community. You touched on certainly the mental health part of the care that you offer, and wanting to expand on, or at least let people know that it's more than just mental health. But what are some of the programs and services that you do currently offer to people and groups in the community?
Sure. So one of the programs that we had added was primary care, in terms of taking care of people as a whole person. One of the things that the research had showed us was that folks with chronic, persistent, serious mental illness died 25 years before their counterpart in the general population, and that was because they didn't always get the preventative care or the primary physical care that they needed. So that is one of the newer services that we've added that really brings people to a place where they can live fuller lives. This time of year in particular, one of the services that we've added is TMS, which stands for transcranial magnetic stimulation. And that's magnets that send a series of pulses to stimulate different areas of the brain, areas that work on mood and depression. There's been 60 to 70% overall improvement for folks that have participated in that. And then there's actually 50% with complete remission of symptoms. So it's a really exciting new.
And one of the key things about this is it's completely non-invasive. So you're not putting medications into your body. There's no surgery involved, no probes and stuff like that. It's completely non-invasive. And it's been very, very effective. And it's also proven to be very, very successful with treatment-resistant depression. So we're thrilled to be able to provide this to everybody here in Ocean County.
What are some of the ways you'd like to see the organization continue to grow and continue to help people in the community?
Well, that's a great question. We could spend a lot of time talking about that, Vin. But I think we've done a good job of that over the last couple of decades in particular. People don't realize, but we provide more than 280 beds, supervision for beds for people with chronic mental illnesses. It's not something that you can just walk up and knock on the door and say, I need housing, but we get lots of referrals from the state hospitals and from other organizations, the county hospitals, and for people who don't have housing and need housing and that's kind of support. So we do all of that as well. We've been trying to grow that program right now, and we're also trying to grow the program in terms of really innovative ways of treating mental illness and addiction services. So that's kind of where we're focusing on right now. We look at what's coming up in the future in terms of new treatments that are being effective for that purpose.
I'm sure, like many others, there's been challenges and hurdles over the last couple of years on and off because of what was going on with the pandemic and everything. How did that affect what you did? Did you have to go more virtual, remote with each other alone, but certainly with, trying to keep things going and helping out people in the community?
Yeah, it was interesting. We went virtual, but it was almost like turning on a light switch because we had to move quickly. As a healthcare facility, we really have to be very careful about the pandemic issues, and we still are. We have very, very significant protocols for anybody walking in and out of our building with temperatures and mask wearing and so forth, and testing. All of our staff have to be vaccinated, or they have to test at least once a week, sometimes twice a week. So we have to be very, very careful. But back in April of 2020, or actually March when it hit, we said we have the ability to go virtual. Let's just do it. And it was like turning on a light switch. The staff really took to it beautifully. We found that we have 40 different programs, and some of the programs worked beautifully with virtual healthcare. Some of them really struggled. So we began to learn over a period of a couple of months what worked and what didn't work. We never completely shut down or shut our doors. We always had a brick and mortar presence as well, as they say, brick and mortar. So we've really done a hybrid approach to this whole thing and really given our consumers the opportunity to choose where they felt most comfortable.
Have you seen a higher volume of people reaching out for services, and in turn more services being offered over the last couple of years, either because of anything with the COVID health-wise itself, or a lot of the fear, anxiety, concerns, people for themselves or for people in their family, friends?
Yeah, I think it's all of that. So what we're seeing right now is a demand for service 3 times prior to what we saw. We're seeing service 3 times greater than the demand than before the pandemic. And I think people waited for a long time at the beginning of the pandemic to get care, and so their symptoms worsened. And I think that we're seeing a tremendous uptick in addiction issues and overdose issues. It's one of the reasons why outpatient detox seems to be working pretty well for people, because they're not moving into a medical setting where they're with people 24/7. They have the ability to work on detoxing during the day, going home, sleeping in their own bed at night, staying safe, and then coming back in the morning and continuing to detox off substances. So we're seeing an uptick in opiate use and alcohol use as well.
Have you had any workings with the Ocean County Prosecutor's Office, for example, with perhaps learning more about the criminal side of the matter or the arrest matter, or how much of an issue that they see it is within Ocean County?
Absolutely. We're really grateful to have the Ocean County Prosecutor's Office as partners with us on several different programs and collaborations. Operation Helping Hands is one of the programs that we work with them. Part of that involves post-Narcan deployment home visits. So folks that have had a Narcan reversal by police officers send their referrals to us, and we have a team, recovery coach and clinician, that will go out and meet with the person who overdosed as well as the family to get them connected to services. That program was largely driven and designed by the prosecutor's office. We're working on an education program together with Ocean County College and the prosecutor's office around helping people with addiction services understand what's happening to them, to their families, helping police officers be on the ground, boots on the ground, with specific training around addictions to help the people that they're interacting with. So it's been a really great partnership with them, and they've always been good partners in that way.
We've always thought it's been important for Bright Harbor Healthcare to be working with law enforcement at every level. So we've really looked for the opportunity. It's wonderful to work with the prosecutor's office. They really have an enlightened staff and enlightened leadership there. I mean, they're certainly cops, and we know that, but at the same time, they really look for what's behind the issues and try to get people help who really need help. We've also been very successful in embedding some of our social work staff in local police departments through a program called On Point, which one of our staff kind of really designed herself, and so we give her a lot of credit for that. I was Megan Corrigan. And the bottom line is it's been very, very successful, and what we've seen is that when a cop goes into a situation where a domestic call comes with some disturbances and problems, they have three choices. They can arrest somebody, send them to jail. They can take them to the screening center and have them hospitalized, or they can say, don't do that again, and they leave and they walk away. And if they say the third thing, which is one of the things they try to do rather than arrest and hospitalize, they end up coming back the next couple of days, next week, and the calls repeat themselves over and over again, and thousands of hours of police time is taken up with these situations. Now, with the On Point program, they refer that person to the social worker in their department. We go out the next day when things have calmed down. We begin to look at the root causes of the problems. And we've had a very, very successful experience in terms of eliminating those follow-up phone calls. To the point, sometimes as high as 85% of those calls are eliminated. And the department saves lots of time in police hours doing that kind of thing. So police officers often see serious mental illness problems more often than my staff do. So we really feel it's important that we work hand in hand with them.
Yeah, I remember being there 5 years ago with Megan and Stafford Police Chief Tom Delane introducing when it was, way back when it was a pilot, and how I've even talked to Chief Delane within the last couple of years about how successful it's been down in Stafford and grown across Ocean and elsewhere, and even got to a point with Chief Delane and then Congressman Tom MacArthur about trying to make this something go national with what your organization was doing in Stafford Police and so many others. So have you seen it even? Okay, wow, yes, yeah. That was good. That was going to be my question. How have you seen it grown in the last 5 years?
Well, yeah, with the help of the county mental health board, as a matter of fact, for some of their funding, we've been able to expand this to 9 different departments, and the towns have been very, very good about buying into it and helping out with it. So we hope to see it in every department in Ocean County in the near future. That's really our goal at this point.
For some of the for all the programs you offer, rather, where if somebody is in need of services themselves, or they have somebody in their family, maybe a close friend, that they want to try to get some help for whatever the issue may be, how can they go about either referrals or just calling up and inquiring?
Sure, there's 2 different things they can do. One very easy, simple phone call, 732-575-1111 is our access center. And there are people there who are trained to talk with them and answer any questions that they may have about programs or family members. But we also have a pretty full website, brightharborhealth.org, that really talks about all of our different programming, so people can sit down and take their time, read what we have, and then call and ask some questions about what might be helpful.
And as far as other places, or website, social media, where can people go to learn more about services, learn more about the organization, and keep up to date with any programs and services that you're offering, or whether it's a one-day thing, a whole week thing, to be able to just learn more about Bright Harbor Health?
Sure. So the website would be a good place. We have a Facebook page and Instagram, so we have a social media presence, and I think that's the easiest way typically to learn about things.
So as we close up here, some final thoughts just on services, programs. What is it you need or want to continue to relay out there to residents of Ocean County and beyond?
Well, I tell you, it's a good question, Vin, especially for this time of year. We know that the holidays can be wonderful times, and they can also be very, very stressful times. And we see people hold it together, try to for their families and so forth, and try to get through the holidays. And then we talk about the after Christmas rush, which comes to us because of people realizing they're having some struggling times right now. So with the pandemic, it only enhances those issues. We think the most important thing to do is to reach out, get some help. As soon as you possibly can, because often if you kind of intervene with these issues early on, you can save a lot of time and effort and really get back on the fast track quickly. So,
excellent. Kim, any closing thoughts?
None other than, Bright Harbor Health really wants to be part of building strong communities. And we want to be here for whatever people's needs are. And, we can't wait to hear from you.
Thank you, Kim. Thank you, Jim.
Thank you, Vin.
For taking out the time to explain. Well, the name change was fun, too, but certainly for all the services that you offer and all the people that you help. For more, head out to their social media platforms, their website, and check out Bright Harbor Health. If you or somebody you know is in need of some assistance, some help, somebody to talk to, check them out. There's no judgments. It's all open. It's okay to ask for help sometimes. We all have those days where we need a little bit of help and somebody to talk to. So check out Bright Harbor Health. Thank you again to Jim Cooney and Kim Veith. I am Vin Ebenu, and thank you for watching another episode of Eyes on the Jersey Shore.